2021-306, an ordinance authorizing a supplemental appropriation in the amount of $1,200,903.18 to provide funds to assist in Salvation Army in operating a safety net shelter for the next 24 months with a grant agreement for 50%, a CDBG subrecipient agreement for 50% of the requested appropriation for the Office of Planning and Economic Development.
Alderwoman Connolly.
Thank you, Chair. I see that we have the continuum of care here. I would ask that Josh Sabo come up and explain the proposal that we were sent and the continuum's recommendations.
That'd be great. Mr. Sabo, I'd like to come up and discuss your proposal, please.
Sure. Good evening. Thanks for the opportunity to speak to you tonight. And we sent the proposal yesterday, and we won't go through it in great detail, but I'd love to hit some bullet points if that's okay. And here with us tonight are several members of the Continuum Board and members of Salvation Army who've been a part of the collaborative process to develop that proposal. So we're grateful for everybody's help in that, and also Mayor Langfelder grateful for the discussion we were able to have around it as well. As we come and as the original ordinance suggests, we obviously have a gap in our community around emergency shelter bed needs. And so the initial proposal was for emergency shelter. And as we've had further discussion about how to meet that need in a sustainable way, but also in a way that could make some funding available for more of a solution to end homelessness, that's what helped us develop the proposal that we sent to you yesterday. To meet the need to address the shelter need in our community, Salvation Army has agreed to help address that gap for us for the next 12 months by providing overflow shelter, case management, and day services in coordination with other services available in our community. Over the course of those 12 months, this issue is going to be a special area of focus for our community-wide strategic plan, which has already started. And so in the next 6 months, we plan to have guidance around how this need might be met in a more sustainable way that we hope to use to develop a plan that could be implemented before those 12 months are up. So the goal is to be able to come up with a sustainable solution over the course of these 12 months that helps us to avoid the uncertainty of having these conversations on a year-over-year basis, but more importantly, that helps us move closer to functionally ending homelessness. The budget, as well as an explanation for how that overflow shelter would work, was included in that proposal. And we're asking for the original ordinance to be amended to a 12-month period of time and to spend up to amount not exceeding $403,000. The proposal also included a number of different pieces of information. We wanted to provide you a little bit of context and the fact that a lot of community partners, a lot of our agencies are already working in a number of ways toward that goal of functionally ending homelessness. The community-wide strategic plan that the city, the county, our medical community has helped to fund has already begun. Homebase and Latham Harris have already begun their work of analyzing data, started to plan on interviews, and the steering committee for that will be assembled soon. As is detailed in that document, Helping Hands is leading an initiative called Housing for Health. That will be a multi-agency collaborative effort that's really focused on addressing homelessness and improving community health. Through the American Rescue Plan, our community received 35 emergency housing vouchers, and those vouchers have allowed for a partnership between the Continuum and the Housing Authority that will use our coordinated entry list to help people from the coordinated entry list into using those housing vouchers. And so through that, we're going to be able to create a move-on program. One of the things that you'll see as a thread throughout that document is that we have an inadequate supply of supportive housing programs. And so what happens when that's the case is we end up with a stuck system. We interact with people in emergency shelter, we interact with people in street outreach, but ultimately we have no permanent housing placement to be able to help those people into, or not no, but an inadequate number. And so those vouchers are helping us to create a move-on program where we can take people who are currently in permanent supportive housing, but who no longer need that intensive case management, and help them to enter into more mainstream services. In addition to that, and connected to that, we've been able to hire a housing navigator. This person will be able to work with landlords, to be able to engage landlords about units that are available and help to expand the number of units that are available to Continuum services. And that person will begin at the end of the month. Our housing outreach team is developing an app that we're going to be able to use to connect with unsheltered people and more easily collaborate as we work to connect people with services. And then also partners in regards to homelessness prevention and diversion. Community partners have been able to invest over $6 million in helping people who are experiencing housing instability. In addition to that, several agencies have already committed to expanding rapid rehousing and permanent supportive housing, while many more are figuring out how their agencies can help with that as well. And in addition to that, the Memorial Behavioral Health is going to be hiring an outreach worker through the CDBG CV funds with support that came from the city that will hire a person who's fully devoted to some of these outreach efforts as well. So that's a snapshot in addition to a lot of the programs that our agencies already offer. There's a lot of momentum moving in the right direction. And so that's why we feel like this is an important time to come forward with this proposal and this process that we hope will not just meet the immediate need, but really put the focus on helping to create more supportive housing so that we can end homelessness together. As part of that, too, the document also included some suggestions, not actionable as part of this ordinance, but hoping that as we move forward, the city and the Continuum can partner on a number of these issues in order to help move forward. One of those are the home ARP funds that the city will get for almost $2.4 million. Those will come to the city through the home grant program, but it's a brand new program that takes some elements of the home grant and combines them with some elements of the COC grant so that supportive services are available, rental assistance, as well as the opportunity to develop more units for housing. We would ask that the Continuum in the city spend a lot of time working together to figure out how to best use those funds and use the guidance that we're going to get through the strategic planning process that we've started. We'd also like to ask the city to commit to looking at how to use $1 million from the CDBG and home grants to specifically focus on units for rapid rehousing and permanent supportive housing. In addition to that, we'd like the city to consider helping us develop a landlord mitigation fund for $50,000. As this housing navigator gets working, as we work to lease up these 35 emergency housing vouchers, a fund like that would really help us develop relationships with landlords, but also make a safer way for landlords to begin to explore partnering with our organizations as well. In addition to that, we're asking for support developing capacity in organizations for supportive housing programs. As we've talked about on many occasions, in order to create these programs, organizations need to hire case managers. And so we're asking for support for $500,000 over the course of 2 years that would allow organizations to begin to expand specifically for the purpose of having more rapid rehousing and permanent supportive housing programs. Again, we don't expect you to take action on that tonight, but we believe all of this is part of the full picture of how we can not just provide overnight shelter in the cold months, but to create some stability from there that we can also move on to addressing the real housing need that we have as a community.
Great, thank you. Any questions? Alderman Conaway?
Thank you, Chair. Josh, can you hear me okay?
I can, yes.
Okay. First of all, I want to thank you for your leadership on this. Thank the entire Continuum. It's great to see you all coming out tonight in support of this ordinance and support of this plan that you've developed together. I just kind of going through some of the things that jumped out at me that I know have been concerns and questions in the past. Sure. The intake process. It's really encouraging to see that there's a coordination among different agencies for the intake process for this. Thank you all for that. I do have some questions, mainly around the services that are going to be offered, because this does have a day component along with the overnight shelter. So can you, or maybe Salvation Army, elaborate on what the services will be?
Sure.
And then also just kind of what sort of outreach and education are we going to be doing to the entire community, because we do have other ordinances on the agenda tonight that deal with some of the other concerns that we have around homelessness. Obviously, even having a day center doesn't mean that people stay inside all day. Right. We still have concerns. I hear from people about panhandling, and we have concerns from people with downtown businesses. So just how we're going to provide education to our community and around what these services are, because this is, again, I applaud you all. This is a really good beginning for us. And I'm excited to be a part of this beginning. And I'm certainly looking through some of the additional asks that you have. I think they're reasonable and that, part of a really good plan that's going to make a huge change in our community.
On day services, I'll start, and then Captain, you correct me if I'm wrong, but as part of that, I think the goal at one level is light touch case management, so that if people need identification or access to services, if people need to get on coordinated entry, that will be a focus. But there'll be also, I think, an opportunity for further case management for some populations as well through that. And then the goal would be to partner with other organizations during those hours as well. Last year, Fifth Street Renaissance had workers come to the Winter Emergency Shelter and offer some of their programs as part of that. Memorial Behavioral Health, with the partnership through the CDBG CV position, can be a part of that. So the goal will be to use that time and have other services connect and be present as well. In regards to community education, I think one of the things that the Continuum needs to do and will continue to do is to communicate what's available and make sure that the community knows about the work that agencies are doing and encourage the community to further support the agencies.
Thank you. Yeah, because I really, you all are doing a lot of work that's critical to our community, and having this as an organized, focused approach I think is going to make a huge difference. I just want to say I appreciate that it's only a 12-month plan, so we're not locked into, and I know you said that very specifically in here, not locked into a single location for this service. So I do hope part of this education and outreach is going to be working with, and I believe Erica Smith mentioned the faith community, to help find a location that comes with community input and support, so that we comes to something that is really long-term sustainable and welcomed where it is.
Yeah, and Erica spoke about that as well. There's a lot of different models that communities use that are workable for agencies. It's something that our community has said for quite a while, that this current seasonal overflow model is a challenge, and this council wrestles with that year over year as well because of that. So we certainly, as a part of that process, will be open to what models come to us. And then I think at that point, once we get some consensus around a sustainable model, we'll begin that process around engaging the community and the city and other partners and figuring out what a location could look like.
Wonderful. Yeah, and I think just having the stability in August of knowing what's going to happen is going to hopefully give everyone some breathing room to get ready for that conversation. So thank you all very much. I appreciate it very much what you've done.
Thank you. Alderman Donovan.
Thank you, Mr. Chair. Mr. Sabo, I want to thank you, you and the Continuum, for all of your hard work. You reminded us last time you were up before the council and speaking that this is something you've all been working on for a great number of months, if not years. And let's face it, the work that you do is not always glamorous, but it is absolutely, I know because I've spoken to a number of you, in your hearts, and it is appreciated because you're the experts. And coming to this body with an actual plan is very much appreciated, because that's not always the way it's done. A lot of times individuals or groups come and they don't like an ordinance or an idea that's been put forward, and that's about all they say, and don't come forward with a solution. I'm happy to hear, a path. I'm happy to hear that you've met with all the entities involved, met with the mayor's office, and had conversations. I'm not going to regurgitate what's in the report, but I will tell you some of the things that I really liked is the fact that one of the goals is not to be wondering annually, year to year, where are we going to be, where are we going to be headed. We're actually trying to get there's I'll say a short-term component of this, and there's obviously long-term that do bring in, and some of the things that my colleagues in this chamber have brought forward, pointed out. There are mental health components, and there are housing components. There are many others that they all seem to have been a consideration of what you're proposing. So thank you for the work, and I appreciate you being here tonight to answer questions.
Thank you.
Alderman Redpath.
Mr. Sabo, thank you for coming, and congratulations to all of you for putting together this proposal. It makes a lot of sense. It's something that we can help take people off the street and put them in good housing. I particularly like the intake process that you're going to put forward, how you're going to evaluate and put people in certain places for care at night. But as we all know, and Alderman Donlin referred to it, there is a capacity of people out there who are going to refuse this and are going to be out there. How do we deal with that? How do we get them to come into the fold?
Yeah, I think the key is that housing outreach team that we've talked about. So really, that MBH worker will be a part of that. But We have our Officer Jones is a part of that team as well. So we have people who are out there always helping the homeless in Springfield that are always out there working and building relationships with people. And that's going to be the key, I think, being able to know people, to know what their situation is, to be able to build that level of trust so that we can at least let them know what's available to them and hopefully help to guide them in the degree that they're looking and willing to access services. But a key part of this is we can't force anybody to enter, as you know, any of these shelters, but we certainly want to make sure that we've got a safe space available for everybody, and we really believe this can make that possible. But that other team is a key part to addressing, that's a very real dynamic, and that housing outreach team is going to be a crucial part of continuing to engage people in relationship. And
there's a lot of people out there that are looking at this and thinking that this could be a solution that we've been looking for several years. So again, I can't thank you all enough for putting together the time and effort to make this happen. And I'm glad that you were able to meet with the administration. Hopefully we can put that together. Thank you.
Great, thank you. Anybody else? Alderman McMiniman?
Yeah, related to the uncooperative individuals situation, where you've got individuals prone on the sidewalk, blocking traffic downtown, passed out. I hope that your plan addresses that situation. It's both a law enforcement problem and a social services problem. And what do we do with those individuals when, I think we've got an ordinance tonight which says we can issue them a citation, but do we have the authority to physically remove them from an inappropriate location?
right.
Creating safety for hazards for pedestrians and a threat to some individuals in that condition. So I just would like to know, where do we take those individuals? Not tonight, you don't have to answer the question tonight, but we want to plan for that because our downtown is suffering, business locations are suffering, and it's been particularly a problem at the marijuana dispensary. And we had a lot of conversation about that in the last 2 weeks, about the impact of people just laying on the ground a block from our hotels. We want to plan for that, a legal plan, and who's responsible for removing that person when they say, sorry, I just want to stay here. I don't want to move. I'm on the ground. I don't want to move.
Right. And our role in that is to make the social services available, to make sure that there's an option for people. The legal component of that obviously is not ours, but in order to make sure that care is available to folks, that's what we aim to do. But beyond that, a lot of that's outside of our scope.
Well, there's got to be coordination. Mm-hmm. The police need to know where they take that person.
Absolutely.
So that's where we need the coordination. It's critically important. Thanks a lot for all the hard work you're doing and all the back and forth that's taking place.
Alderman Gregory?
Thank you, Alderman. Mr. Chair, I just want to make it clear I've always been a very vocal supporter about this situation, so I hold various passions for it. But I just have a few quick questions because I do want to support it. But it has to be. I have some questions that I just need to address. So. And these are very short, really yes or no questions to help me greater understand some things. So, have you, has the Continuum had any conversations with any neighborhood associations on the east side of the tracks? We're planning on having this. Have we had any conversations with them?
Regarding the overflow shelter, we've not.
Is there any reason why?
I think in part because that's where people are, and that's where the conversation was around the building. But that would be the only reason at this point. And I'd say the other component is that this is a temporary solution. It's not a long-term solution, and so the goal, if anything was to be more permanent, obviously would be able to have an intentional community process around what happens from there.
Okay, thank you. Can you explain to me a little bit why this is not a 24/7 situation? I just have a little issue with the intake. I question myself if we have, in the notes, I know one of the entities won't breathalyze the homeless anymore. Maybe that will help some of them get in there. So with this entity, if we're going to put them out at 7:30 a.m. every morning like we do at one of our local places now, how is that helping them? I mean, I know we have other services available, some day centers and things of that nature, but the problem that we're struggling with right now to try to figure out is a situation for our street homeless, the people who don't fit this perfect criteria to get them step to the next track. That is what I see when I'm out there hanging and barbecuing and all of those things. That's what I see. I see some individuals that, and then the people at Helping Hands come over and they're just in such better shape. So I just don't know how this population, if we have beds available, similar to the Alderman Redpath's question, is going to go to there. So if they refuse, what do we do then? I mean, are they just going to still camp outside the facility?
Yeah, I mean, in terms of the encampment, again, I think that's a little bit outside of our scope. The reality is, we offer shelter beds as a community. We need to offer adequate low-barrier shelter beds. This overflow shelter will match the low barriers of Helping Hands. So the goal is to really make that, to the degree that it can be a seamless operation. So it'll involve a great deal of collaboration between the existing shelters. It's going to need to involve really intentional training about staff and close collaboration about how to handle, situations as they arise as well. But in terms of, as a community, it's great to be able to offer some client choice to the degree that we can. But as a community, too, we need to be able to use the available shelter beds we have so that we can really put that focus on housing. And in terms of meeting the criteria, right, I mean, our approach is housing first, meaning so that if a person is alive, they're worthy of being housed on the basis of being a human. And so they meet the criteria. The issue is being able to develop as a community the system, the resources, and the ability to connect people with that housing as quickly as possible.
I agree with that, but there is some situations where we would be fooling ourselves if we think that we can put some individuals in just a home by themselves, or I know there's some supportive housing situations. But that's the part that troubles me. I mean, I'm not comfortable investing all this money into a situation, and we're still going to look at, have this issue, and that's the part that troubles me is that, I feel like we're going down the same cycle that this is fine. We're going to let them in at night. We're going to put them out at 7:30 in the morning. We're about to consider 3 ordinances to ticket homeless people. I mean, maybe it's me. So what I was looking for, and what I was willing to really explain to the community that has to deal with this building is that we needed some time to get to a permanent situation. To do that on a 24/7, especially with this COVID and Delta variant. The CDC tweeted that it's not the smartest idea to break up these encampments and send them out to the community for various reasons. So I'm struggling with that point of it. So I thank you for that dialogue on that.
Alderman,
sure.
There's one for your question I didn't answer, if that's right, too. So it just in regards to 24/7. It's virtually impossible for a 24/7 shelter to function as an overflow shelter, because people, in terms of leaving and coming back, it just, in terms of the way the system works, that would be one barrier there. And the other part is just from client interaction. In terms of 24/7 shelter, it doesn't mean that if we offer services 24/7 in one location, that individuals are going to stay in that location, and we certainly would have no intentions of assuming we don't end up with a more dire COVID outbreak, and forcing people to stay in a location. So, the reality that people are free to kind of go as they choose to is one of the dynamics there. And then in terms of just sustainability of 24/7, that's a very difficult operation to run. And so for us to be able to partner across the continuum with other agencies and, again, continue to foster that collaboration, that's the reason that we did that. And then in the proposal, it's an average of 6 hours a day of day services. So that allows some flexibility to have more hours on the weekend when other services are closed, more hours when the weather is cold or inclement, but on days that are really nice and people want to be outside. It could be that the hours could fluctuate along that, but that's the reasoning for that being the way it is in the proposal.
All right, thank you.
Alderman Williams?
Yeah, thank you for coming. I appreciate, the attempt. I looked at the plan and I keep asking myself, so what is different? What is new? But I appreciate the effort, and I truly understand that these are complicated issues, and they're not as simple as they look on the surface. But the first thing I would say is that, the part of town that I represent and that Alderman Gregg represent, we don't have hotels. We have homes. We have neighborhood associations. We have places where people live. Where the homeless are, we'll hear around the shoe say in front of hotels, downtown, in front of houses, across the street from schools, across the street from where people live, residences. So it's important to open up that engagement with those people also, not just the downtown area or the hotel owners or businesses, but also residences. If you would please look at that. Number two, I would say we're calling it a 12-month plan. So when will we start seeing results, would you estimate? We start seeing some improvements of what we're seeing now?
Yeah, the key would be however long the hiring process and training process would take. So I think I would leave that question to Salvation Army, but with approval, that process could obviously start quickly, and then it just would be a matter of how quickly staff can be hired.
Okay, and finally, I just don't want to get caught up. And around the shoe, as we have had these discussions, I've heard everything from we need to close down Tent City, get rid of it. I've heard they need to be arrested. I've heard ticketing, all these different things. But the thing we don't want to do is give the perception that we're doing something about it. We pass these ordinances, and they still see a tent city. They still see people panhandling. They still see people laid out on the sidewalks. They don't see a change, but they saw money get approved. So I've always advocated if they're mentally challenged, then why isn't the money going? A strong component of this has to be dealing with that to find out, do they need to be in an institution? Or should they be out on the streets? Because if they don't have the capacity to understand, here's a bed for you. I'm struggling with this because there's a tent city, but then Helping Hand says, well, I got 30 empty beds. Well, you see what I'm saying? So I'm just trying to make sure when we direct funds somewhere, it goes where it's most impacted. It's really going to fix this problem and not just pass something and we just do what we've been doing.
Yeah, Alderman, thank you. In terms of the overflow shelter model, it's not new, something that's been around in our community for almost 2 decades. Mm-hmm. So that part of it is not new, and we do not hold it up as a solution to homelessness in any way, shape, or form. It is a solution in part to part of the current crisis. It creates enough safe beds for people to access as soon as it opens. So that's a positive step. But if we as a community stop there with shelter beds, we've missed the plan on what this proposal is attempting to lead us toward and the work that we'll continue to do. We've got to expand supportive housing, and if we can help people get to a place where they can thrive in supportive housing through rapid rehousing, permanent supportive housing, and other programs, then people are going to be in different places of their lives and likely different places in our community too. So I think that the real answer is we have to connect people with permanent and supportive housing in order to truly address this issue. In the meantime, as a community, I think the very bare minimum we can offer is a safe bed for people tonight, but we can't stop there. And in regards to the encampment, I think, I don't know to what degree, those conversations have been had. Communities have handled that a number of different ways. When adequate beds are available, I think that creates a space where the community can talk about what to do next. I think from an outreach effort, when we know that this shelter is going to open, we'll begin talking to people, encouraging them to take advantage of the safe beds. But in our community, we typically have a bit of a movement each year. As it gets cold, we see shelter numbers rise. As it gets warm, we see shelter numbers go down. So there's commonly that fluctuation. But we certainly want to encourage people to take advantage of the stability that would come from a safe bed as a starting point, but certainly not as a final answer in terms of those home ARP funds, expanding case management, really building out the housing programs. That's the key. And this strategic plan is going to help us think about all the funding mechanisms in our community that can help us do that. And then we as a community, we have to act on it. We've got to take steps forward, or we will continue to be in the same spot, and people will continue to suffer outside our doors. So you're right. This is not the solution. It's not new. It's what's needed now to handle part of this crisis, but we've got to keep moving forward.
Well, I appreciate you and the team for your efforts. Thank you.
Alderman Hanauer?
Thank you. Real quick, Josh, good job to everyone that was a part of this. The answer to the question of what's different is this: we are not the ones making decisions up here on how the care is given, the staffing, whatever. We've allowed the experts to come forward, develop a plan. You guys know your business better than any of us up here do. And so what we're doing is we're giving, we're putting a lot of faith in you guys that, you're going to take this plan, and I'm sure there's going to be a little bit of, it's going to be fluid at first to try to get, as any plan is. But so we get through this year, and then we move into more of a permanent solution that as we start winding down, and hopefully, I think Erica said, ending homelessness in 5 years. And that's what's different about this plan than other plans that we've had before us. And so for that, I appreciate everyone that's taken part of this, and good job to you all. My question is, okay, what do we do with this? I'm willing to send it to debate with the idea of next week we'll have a formal amendment to match what you guys have put up. As a matter of fact, I'll make that motion if everybody thinks that's pertinent.
I would second that.
Let's go.
Yep.
Okay, I make the motion. We put it to debate, and with the anticipation of having it amended next week on the floor.
Second.
Okay, so we got a motion for an amendment and a second. Any discussion on the amendment?
And may I just...
Sure, please.
You brought up the exact correct thing, because what we need is, remember, the subrecipient agreement right now is with Salvation Army. So there's a very detailed plan, safety net plan with a budget. We need to get an updated budget and/or description of the plan so we can make that adjustment. Sure. Okay. So I don't know if Salvation Army would prepare it and give it to us, or how that's going to actually occur.
Do you mean in addition to what we sent yesterday?
Yeah, there was no budget. Have you looked at the ordinance? It's got a very detailed budget and also
Right.
the plan.
Yeah, Appendix A is a budget,
Services.
and right before that is a shelter structure for a plan. But if you need more than that, we'll provide whatever you need. I mean, Salvation Army helped create those pieces.
That's why I'm actually asking Captain Eddy to if he could give us the updated, like the budget, like you've done before. You gave us a very detailed breakout of personnel and all that, and then also how the plan changes. So that way you can vote on the detail. Perfect. Okay. And if we get it, we can circulate that, much prior to the meeting.
Okay. Alderwoman Connolly, then Redpath.
Thank you. And I will say, probably we would need a little more. I would just like to know, because the Appendix B to this has, I think, as detailed the budget as what was in the original ordinance. I mean, the original ordinance referenced Peoria a number of times, so I'm not sure. This plan is very specifically designed and built for Springfield. So I'm ready to send it to debate tonight. I just really quickly wanted to add, because I think Alderman Williams brought up an issue that I know is near to his heart and on the top of everyone's concerns, is the mental health component. And again, I'm very encouraged to see that Memorial is not part of this budget, but Memorial on their own is contributing a behavioral health specialist. So can I just ask what the hours will be for that position?
That position was created through the CDBG CV funds.
Okay.
So I don't have all the details on that at this time.
But there will be someone, is this a full-time position?
It is. Mayor Langford might have more details on that than I do.
Yeah, actually, that was funded through our CARES Act, $100,000 with the priority that it be for street homeless outreach as well as the overflow shelter mental
That's
health
the position we've
treatment.
already approved. Okay, perfect. So that's, I mean, I think that goes a long way towards, it goes a long way towards addressing the concerns about people who have mental health concerns and really do need a higher level of skilled interventions. So really excited about this, looking forward to voting on it next week.
Thank you. Alderman Redpath?
From what I read, the email that we got, is all that going to be incorporated into the amendment, Mayor? You could.
Yeah, what it would be is, I talked to Josh at length today, and there's some recommendations for clarification, and really that's a blueprint informational piece for the public, as well as direction everybody would like to go. So that would be included in the document. With the subrecipient agreement, it'd be specific towards Salvation Army and all the agencies that would help with the supportive services associated with the overflow part. The other pieces of allocations towards the home funds, as well as I think there was $1 million for rapid rehousing, $500,000 for case management. That would be handled separately with those initiatives, because you have to specify who's doing what and how's that deliverables going to be, how's that going to proceed.
Could we ask Corporation Counsel to expedite this so we could have it sooner than later?
I think I'm trying to be helpful, because I looked through the materials, and it's not up to me to try to filter it for the Salvation Army. I just want to make sure we're being accurate. So I actually sent you an email asking if you could please just give us whatever the corrected services are and the updated budget, then we can do an amendment to make that consistent. It's just going to substitute that with the subrecipient agreement. So we just need someone needs to give me the detail. I can't really go through and I pick it out. It's hard. I mean, I'd probably make a mistake, and then everybody would be mad.
We just want to make sure that this is a very important piece of legislation that we have to get through, but we need to make sure that everything's in it.
What the mayor indicated, the other spending, normally what you'd end up happening is on these other pieces, you'd end up with separate either subrecipient agreements or some kind of service agreements, so you would get to see the detail.
And this is going to be ongoing. They've said that this is the first step into the process, what we need to do. So I support it, and I second the motion.
Mr. Mayor?
Yeah, I think Josh and I were going to regroup and finalize that, hopefully document, but what we'll do is extract for the subrecipient agreement. It's no different from other ones that we'll modify that based on the information we received with the budget and the amendment, and then represent it as one amendment associated with the overflow piece of it. And then, but that whole packet will be part of the ordinance.